Hi, my name is Alshaunti, and today I will be discussing post-fall assessment interventions, patient teaching, and documentation from a nursing perspective. Falls are a major patient safety concern in healthcare settings, and it is important for nurses to respond quickly and effectively to reduce the risk of injury and prevent falls. In this presentation, I will explain the purpose of post-fall care, how to assess the patient, possible conditions related to falls, appropriate nursing interventions, patient education, and proper documentation. The purpose of post-fall assessment is to identify any injuries or complications that may have occurred, ensure patient safety, and prevent further harm. It also allows the nurse to provide timely treatment, notify the healthcare provider, and implement interventions that reduce the risk of future falls. Proper post-fall care is essential for maintaining patient safety and meeting legal and professional nursing standards. After a patient experiences a fall, the nurse begins with an immediate and systematic assessment. First, I assess the patient's airway, breathing, and circulation, followed by vital signs and level of consciousness. I then perform a head-to-toe assessment, paying close attention to the neurological status of the patient, including orientation, pupil response, and strength. I assess for pain, bruising, swelling, lacerations, or deformities, or limited range of motion. If a limb is involved, I perform neurovascular checks by assessing pulses, capillary refill, skin color, temperature, sensation, and movement. I also gather information about how the fall occurred, whether it was witnessed or unwitnessed, and review the patient's medications for fall risk. Several conditions may result from a fall, including fractures, head injuries, soft tissue injuries, and internal bleeding. Patients may also experience orthostatic hypotension or the fear of falling, which can limit mobility. Certain populations are at a higher risk for complications, such as geriatric patients, patients with osteoporosis, and those taking anticoagulants. Identifying these risks helps guide the nurse's interventions and monitoring. As part of post-fall care, I review the patient's medication list to identify drugs that increase the risk of falls, such as opioids, benzodiazepines, antihypertensives, and diuretics. I administer pain medication as prescribed and monitor the patient for side effects. Any medication changes are communicated to the healthcare provider to ensure safe and appropriate care. My immediate nursing interventions focus on safety. I do not move the patient until injuries are ruled out and I call for assistance. If a head or neck or spinal cord injury is suspected, I maintain spinal alignment. I control any bleeding and provide comfort measures. Once it is safe, I assist the patient back to bed or to a safe position, notify their provider using SFAR, and follow any new orders. I also implement fall precautions, including placing the bed in the lowest position, activating bed or chair alarms, ensuring non-skid footwear is worn, and keeping the call light within reach. Patient education is an important part of preventing future falls. I teach the patient to call for help before getting out of bed, use assistive devices correctly, and change positions slowly to prevent dizziness. I also explain how certain medications may increase the risk of falls and encourage the patient to report any new symptoms such as dizziness or weakness. Accurate and objective documentation is essential after a fall. I document the time, location, and circumstances of the fall, along with the assessment findings, vital signs, and any injuries noted. I include all interventions performed, provider notifications, orders received, and the patient's response to care. I also document education and fall precautions implemented. An incident report is completed according to the facility policy, but is not included in the patient's medical record. In conclusion, post-fall care requires prompt assessment, appropriate interventions, patient education, and thorough documentation to ensure patient safety and prevent future falls. As nurses, our role is critical in identifying injuries early, reducing risk factors, and providing safe evidence-based care. Thank you for watching my presentation on post-fall assessment and interventions.